Did you know that it's possible to enhance the shape, size and symmetry of lips using an array of both surgical and non-surgical techniques? Hi, I'm Dr. Mrinalini Sharma, a plastic and cosmetic surgeon practicing in Estiva Cosmetic Clinic, Saket. So today we're going to be discussing about the various techniques which are available and the various possibilities in enhancing the shape, the size and the symmetry of your lips. Lip jobs are a very popular plastic surgery procedure. तो जब भी लिप जॉब की बात होती है तो एक पॉपुलर मिसकंसेप्शन ये है कि इससे हम सिर्फ लिप का साइज़ बढ़ा सकते हैं, बट नो. Lip jobs include a variety of procedures. We can do lip fillers which increase the size of the lips. We can reduce the size of the lips using a surgical reduction technique. Also, we can correct asymmetries in the lip. So sometimes people have a lip which looks a little longer on the right side, a little shorter on the left side, or say that the size of the upper lip is not really proportionate to the size of the lower lip. So this can also be corrected using techniques which are both surgical and non-surgical. Another common problem which can be addressed by lip jobs is a gummy smile. So क्या होती है gummy smile? Gummy smile का मतलब है कि when a patient is smiling तो उसका बहुत ज़्यादा गम शो हो रहा है. So आपको उनके मसूड़े जो हैं बहुत ज़्यादा दिख रहे हैं. So ये भी एक प्रॉब्लम है जो लिप जॉब्स सर्जिकली या नॉन सर्जिकली एड्रेस कर सकती हैं, इम्प्रूव कर सकती हैं. Another common procedure which we perform on the lip is that of a lip lift. अब लिप जो है एक स्किन के पोर्शन को भी हम अपर लिप मान के चलते हैं. सो दिस पोर्शन इज ऑल्सो कंसिडर्ड द अपर लिप. सो एज वन एजेस, जैसे एज बढ़ती है, दिस सेगमेंट टेंड्स टू गेट लॉन्गर, जिससे कि लिप जो है इनवर्ड रोल लगता है, पतला लगता है. सो लिप लिफ्ट जो एक प्रोसीजर है, इससे हम इस इश्यू को भी एड्रेस कर सकते हैं. एक और चीज़ जो हम एड्रेस कर सकते हैं वो होता है द प्रोपोर्शन बिटवीन द अपर लिप एंड द लोअर लिप. सो जनरली व्हाट लुक्स गुड इज दैट द अपर लिप शुड बी अबाउट 2/3 of the lower lip, and some people don't have this proportion. Some people have equal lips or an upper lip which is thicker than the lower lip. So this also can be addressed using plastic surgery techniques. So first let's talk about a lip lift. As we age, our upper lip segment tends to grow longer, which gives us the appearance of thinner lips and lips which are rolled inside. Now this problem is not simply resolved by adding more volume. कि filler डालने से ये shape ठीक नहीं होने वाली. So here comes in the role of a lip lift, in which हम इस segment को छोटा कर देते हैं. We reduce the length from the nose to the upper lip, which gives the appearance of a lip which is more outwards and also looks fuller. Now this is a very small daycare surgery and is an excellent procedure for people who are, say, a little fairer skinned, because in them it doesn't leave any visible marks. However, a point of caution is that we should not be attempting this in a person who has a darker complexion or a person who is younger, because otherwise it can lead to very visible scars which might become a problem later on for the patient. It's a small procedure, as I said, and can be done in a local anesthesia also, provided that the patient is comfortable and not apprehensive. There's hardly a downtime of about a week or so, and there is no major problem like swelling or bruising of the lips after this kind of a procedure. Results are permanent and tend to last, I would say, almost 7 to 8 years. What changes is the aging changes which occur on the face. Otherwise, these results are pretty much long lasting and are very satisfactory. A procedure which is very common these days is that of lip reduction. तो lip reduction हम कब करते हैं? या तो दोनों lips का size बहुत बड़ा है and the patient says that I want thinner lips in general, और जब lip proportionate नहीं है. सो आइडियल लिप प्रोपोर्शंस क्या होते हैं, जिसमें आपका जो अपर लिप है वो तकरीबन लोअर लिप से 2/3 साइज का होता है. सो दिस इज़ द आइडियल लिप प्रोपोर्शन. सो इन पीपल हु हैव अ थिकर अपर लिप, वी कैन रिड्यूस द अपर लिप सो दैट द प्रोपोर्शन गेट्स बेटर. Also, some people, say Africans, have very thick lips and they are the ones who most common for a reduction of both the upper and the lower lip. This again is a minor surgical procedure. If it's a single lip, it is comfortably done under local anesthesia. Some patients, especially when we're doing both the upper and the lower lip, इन्हें general anesthesia की ज़रूरत पड़ सकती है. Procedure time तकरीबन आधे घंटे से 1 घंटे का रहता है, depending on हम एक लिप कर रहे हैं या दोनों लिप कर रहे हैं. जो टेक्निक ऑफ लिप रिडक्शन है वो एसेंशियली लिप का शेप मेंटेन रखने की होती है, तो हम साइज़ कम कर रहे हैं लेकिन इससे आपकी लिप की शेप ख़राब नहीं होने वाली। दैट्स वाई अपर लिप को रिड्यूस करने का जो तरीका है वो थोड़ा सा अलग होगा, लोअर लिप को रिड्यूस करने का तरीका थोड़ा सा अलग होगा, जिससे कि हम सिर्फ वी चेंज द साइज ऑफ द लिप बट द शेप रिमेन्स इंटैक्ट। A very common question which I get asked is, doctor, does it leave scars? No, the cuts are made in such a way कि वो लिप के अंदर वाले पोर्शन में होते हैं जिसे हम म्यूकोजा कहते हैं, एंड म्यूकोजा पे कभी भी कोई निशान नहीं छूटता। अगेन इसका डाउन टाइम इज़ वेरी लेस, मे बी अबाउट a week 10 days। हाउएवर वन वर्ड ऑफ कॉशन आउट है, जब भी हम लिप सर्जरी कर रहे हैं तो लिप में स्वेलिंग ज़्यादा होती है कंपेयर टू अदर बॉडी पार्ट्स, तो पूरे रिजल्ट्स आने में तकरीबन 1 month to 6 weeks लग सकते हैं। दिस इज समथिंग विच वी वांट द पेशेंट टू नो। तो जब भी आप अपने रिडक्शन के रिजल्ट्स जज कर रहे हैं तो उसे कुछ वक्त दीजिए। इट विल टेक अबाउट a month and a half for the results to be kind of final and for the lips to be reduced to the size you want them to be. Lip fillers used for enhancing the size of the lips is the most popular lip job in plastic surgery. Now, lip की वॉल्यूम बढ़ाना इज़ मोस्ट कॉमनली डन यूजिंग hyaluronic acid fillers. इसमें अलग अलग कंपनीज़ हैं जो फिलर्स बनाती हैं, एंड दीज आर इक्वली गुड इन मोस्ट केसेस, एंड दे कैन बी यूज टू चेंज द size of the lip and to some extent the shape of the lip as per the patient's desires. Now, इसमें कुछ बातों का हमें ख्याल रखना है। एक तो ये कि the technique has to be perfect. So these services are being offered by many so-called cosmetologists also these days. So whenever you're planning a lip job, be very sure that you're going to a trained person, a qualified surgeon, or to a qualified dermatologist for that matter. But don't get these treatments done at cosmetic centers with ill-trained staff, because though it's a very safe procedure, it has to be done the right way, and the person to perform it should be knowing the anatomy of that region. उसे exactly पता होना चाहिए कि lip filler कहाँ डालना safe है, कैसे डालना safe है। Done properly, lip fillers can not only increase the volume जैसे मैंने बताया, वो लिप की asymmetries भी करेक्ट कर सकते हैं, कि जैसे अगर कुछ पेशेंट्स हमारे पास आते हैं जिनका लिप एक तरफ से थोड़ा सा कम थिकर है, नैरो है, या लिप में कोई नॉच है, गैप है, ये सब भी हम लिप फिलर से ठीक कर सकते हैं। अगैन दिस इज़ कॉल्ड अ लंच टाइम प्रोसीजर। इसमें हार्डली 1-1.25 घंटा लगता है। द रिजल्ट्स आर लॉन्ग लास्टिंग। नाउ रिजल्ट्स विल लास्ट एनीथिंग बिटवीन 9 months to about a year डिपेंडिंग ऑन द काइंड ऑफ फिलर विच इज़ बीइंग यूज्ड। आपका लाइफस्टाइल कैसा है। It will last a little lesser in people who are smokers or in people who have a very active exercise regime. So people who are actively into gymming, in them the filler might last a little lesser. So maybe around 6 to 9 months is what they can expect. So overall, it's a very good procedure with a high satisfaction rate. The only thing is lip fillers require repetitive sessions to maintain the results. So सबसे common procedure जो the patient wants to get done from us is an increase in the size of the lips when you're talking about the lips in general. अब इसमें सबसे कामयाब और सबसे common जो हैं वो lip fillers हैं. However, other than the lip fillers, there are 2 more techniques which can be used. One is tissue grafting, in which हम body के एक जगह से एक chunk of tissue लेते हैं, tissue का एक टुकड़ा सा लेते हैं और उसको surgically lip में insert करते हैं. Now, earlier days when lip fillers were not an option, this was a popular technique in patients, especially जिनमें birth defects होते थे, lip का size बहुत ज़्यादा पतला होता था, उनमें ये technique use की जाती थी. कुछ negatives हैं, कुछ positives हैं. Negative is it requires a small surgery. It is sometimes not very predictable results. बहुत predictable नहीं होते. जितना हम अभी lip fillers use करके defined shapes बना सकते हैं, उतना tissue grafting से possible नहीं है. Advantages ये हैं that compared to a lip filler जो temporary होता है, जिसको आपको every 9 months or every 1 year repeat करना पड़ेगा, tissue grafting tends to be lifelong. However, it is still less popular as a choice compared to lip fillers, which are universally more popular and are the ideal choice in many patients, except in people जिनको say filler से known allergy है, या जिनको कुछ ऐसी problems है जिसमें tissue grafting becomes the only possible solution. The other technique which is used still sometimes is that of fat grafting. So हम fat grafting body के बहुत parts में करते हैं. We do it on the face routinely, we do it on the breast, we do it on the butt for butt augmentation. So similarly हम fat grafting को lip पे भी use कर सकते हैं. However, one problem which I want the patients to know is that fat does not stay very well in areas जहाँ movement बहुत ज़्यादा होती है. And lips obviously आप जानते हैं हम बात करते हैं या हम खाना खाते हैं, it is not possible to keep the lips static, उनमें movement आनी ही आनी है. That is why fat grafting does not succeed just as well in the lips as it does in other body parts. So if you are thinking of getting a fat grafting done, be prepared for repetitive sessions. You would require maybe up to 6 to 7 sittings to get a good result out of fat grafting for lips. However, the advantage is आप अपने body का ही एक tissue use कर रहे हैं, so the chances of any kind of an infection or an allergy are practically none. And yes, once you're done with the 6 to 7 sessions, the results are almost lifelong. Another procedure which used to be used earlier on was that of implants, but I would strongly advise against this procedure being used currently because इसमें बहुत सारी complications देखी गई हैं. ऐसे भी cases आए हैं जहाँ पे आपका जो lip tissue है वो that has necrosed, उसकी blood supply चली गई है, leading to permanent scars and permanent deformities. So these days, if you're thinking of a lip job, do stick to either lip fillers or, as I said, fat grafting as an option, and do not consider lip implants. So now let's talk about a very different aspect of lip treatments. Lip treatments can also be used to change your smile, or in fact I would say rather than change, improve your smile. So there are some problems which can happen in a smile. So some patients say that doctor जब मैं मुस्कुराती हूँ then my smile is crooked on one side. Now this can happen because of say childhood disorders, पैदाइशी conditions जिसमें आपकी जो एक nerve है वो उतनी well developed नहीं होती. So इससे क्या होता है, when the patient smiles, the lip might droop more to one side, वो टेढ़ा हो सकता है, and the patient does not have a straight smile. So in this also we can use surgeries in severe cases, or in majority of cases we can use Botox treatments which are going to balance out your smile. So this is again one important part of lip treatments. There are certain other issues which develop with aging. So one of the most common complaints which a patient might have when she comes to me is that, doctor, but the corners of my mouth are droopy, and even when I smile I look sad. So that's another thing which we can use, which we can correct using a combination of lip fillers and to a certain extent those anti-wrinkle treatments which kind of balance out the muscles which are being used while smiling and give you a more balanced and a more symmetrical smile. A common problem which patients face is that of a gummy smile. So this means that when the patient is smiling, a lot of the gum portion is visible. This can also be taken care of by two techniques. One is if the patient's lips are too thin and that is the reason of the gum show, then we increase the volume of the lip. The other is when the patient's lip has a decent volume but still there is a lot of gum show. In this case, we are going to be using Botox to kind of balance out the muscles which elevate the lip and thereby decrease the gum show while smiling. So we can not only increase the size of the lip or decrease the size of the lip, there are techniques which are available which can also improve the symmetry or asymmetry of your smile and give your face an overall balanced and pleasing expression. If you found this information useful, please like and share my video. And for further queries regarding this topic, you can drop your comments in the comment section below. Thank you.